Hello, everyone. Good afternoon, and welcome to today's webinar. My name is Chimelu from Solina Center for International Development and Research, and I'm going to be your host for today. Thank you very much all for joining today's conversation and joining on time. We are just going to give a couple of minutes for some of us to join the conversation, and then we're going to kickstart it and start to discuss some of the things that we have lined up for today's conversation with some of our speakers and panelists here. Welcome, everyone. Great to have you. All right. Hi, everyone, and welcome to today's webinar. It's great to have you here joining us on the Nigeria Learning Collaborative for Social Norms. And we're kickstarting today's webinar. And we'd just like to hear from you. What's your name? Where are you joining us from? And where do you work in terms of your organization, as well as specific area of expertise or specific area of work. So please put that in the chat box so that we can see where you're joining us from and interact with you while we kind of hold on for others to join the call as well. So please go ahead and put it in the chat box, and let's see who you are and where you're joining us from. Hi, Marilyn. Great to have you from Lagos. Hi, Halima, Rihanna, and Ikechukwu. It's great to meet all of you. Thank you for joining the conversation, and thanks for joining on time as well. We're just going to go ahead and kickstart today's conversation. And as I mentioned, this is another segment or another edition of our NLC webinar knowledge series, and we're going to be sort of taking a different dive than we had in previous conversations. So it's all great to have all of you here with us. In terms of how the conversations will go today, we just want to make sure that we have a very seamless conversation. So please ensure that you mute yourself when you're not speaking so that we try to limit interference and background noise. Also, please use the reactions button, raise your hand, or put in any information or questions or thoughts you may have in the chat box so that we can interact adequately with you. You can also go ahead and just share with us on social media using the hashtag NLC social norms, and we can just interact around this this webinar and get your feedback and your thoughts. So for today's conversation, we're just going to kickstart it and just give you sort of a brief overview of what the Social Norms Learning Collaborative webinar series is about. And our goal really is just to ensure that we objectively share some information, insights, and research on social norms, norms programming, and just basically norm shifting or normative change broadly. Of course, starting with Nigeria, but we do hope to sort of over time have that information progress to Sub-Saharan Africa and the world at large. We kickstarted this webinar series in August, and we did take out the time to discuss with some of you who are joining us here today around what social norms are and the impact on health and development outcomes. And we did take some time to see how prevailing norms typically affect some of the indicators that showcase health outcomes generally, and how those norms also affect specific individuals who are impacted by those. This month, we sort of delve a little bit deeper, and the goal is really for us to understand what works when it comes to norm shifting or normative shifts in a context that is as complex as ours. We would also like to introduce you to our podcast series, which starts this October. It's already out on different platforms, and we would like to bring that conversation to you using a very short snippet, which I'm going to play for us to just kind of hear and see. All right, thank you, everyone. We are going to play the podcast snippet after the conversation so that we can sort of discuss around that. But before we get into the meat of the conversation for today's webinar, would like to just quickly do a question poll, and you can just go ahead and interact with the answers on your end. But essentially, the question that we're asking here is, and I'm sure we're all very familiar with this being actors within the health and development space around what female genital mutilation is. And basically the question there is, we understand that it's a norm that's sort of rooted or anchored in a lot of gender inequality and GBV broadly, but would like to know, what are your thoughts around the regions in Nigeria that have the highest rates of FGM? So please feel free to just quickly go to the poll and then share what you think the answer is, and then we can then agree, we can then sort of align on what the response is here. So please just go ahead and interact with the icebreaker. All right, so we have some answers coming in on the poll. Let's just keep the answers coming in. End the poll. All right. So I think we can go ahead and keep voting or putting our answers in the poll on what the answers here could be. All right. It seems like the answers of the poll have come back, and we have quite a number of people who believe that the answer is the northeastern region of Nigeria. We also have some people southeast, southwest, and then some people are pointing out that it could be equally distributed across regions. And this is interesting because the results from research show that the southeastern part of Nigeria actually has the highest rates or prevalence of female genital mutilation. And that's very interesting because we would believe, or we would think, that in more restrictive or more conservative places or regions like the Northeast, or basically the northern part of Nigeria, we would have this norm as very prevailing, but it's very interesting that it's actually most prevalent in southeastern part of Nigeria. And it just really indicates how that's a result of a lot of underground as well as secret practices that are currently going on. And as people within the health and development space, it's also important to acknowledge how this means that we have a lot more people. I mean, the girls are the ones who are involved here specifically that are in danger. A lot more girls are in danger than we actually know or understand. And so it indicates the need for that, sort of broad thinking around normative shift and trying to deploy interventions that would adequately address these norms. Now, female genital mutilation is an example of a norm that needs to be shifted or addressed, but there are many others that I'm sure that we've been in contact with that have that impact on health and development broadly. And so that's why for today's conversation, we're really trying to look at how you can do social norms, what are some of the strategies that are involved there, what are some of the considerations, and what are some of the practical experiences that people, implementers have had over the couple of years, and then we can sort of think about how to also apply that to our different programs. And so for today, I'm quite excited to sort of introduce all our speakers for the day. We have Maryam Yusuf from the Busara team, and she has been leading a lot of Busara's research work around behavioral economics as well as science, and she's been able to sort of lead teams that facilitated service uptake and delivery, as well as just broadly scaling interventions that addressed service uptake across Africa. And then we also have Madanda from Care International in Uganda, and he's going to be joining us today. And he is a gender practitioner with over 2 decades of experience implementing a lot of interventions that target women's empowerment generally and gender equality. And finally, we have from our SCIDaR end here, Halima, who has been anchoring a lot of SCIDAR's work with demand generation in both routine immunization, polio, as well as PHC very broadly. And it's really great to have all of you speak to us today. And the conversations are just really going to be focused on just sharing around some of the key principles for designing norm-shifting interventions. And then we'll go ahead to showcase a lot of the insights from our speakers' experience with implementing these interventions. So I would like to just hand over to Maryam, who's going to take us through the first component of the conversation around some of the foundational thinking for norm shifting. Hi, Maryam.
Hi, Maryam. Hi, Chimelu.
Oh, yes, go ahead.
Okay,
Thanks.
lovely. Thank you for that introduction, and good afternoon, everyone. Thank you for joining. It's a pleasure to be part of this webinar. So I'll start off quickly by giving a brief intro to the Busara Center. So the Busara Center is a research and consulting firm that focuses on applying behavioral science in the pursuit of poverty alleviation. That is our main mission, and we operate mostly in the global south, which is mostly Sub-Saharan Africa, Latin America, and parts of South Asia and Southeast Asia. So in a nutshell, our work is applying behavioral science to help both public and private sector organizations, businesses, individuals to better ideate solutions for behavioral challenges with a mix of both qualitative and quantitative research. So that being said, I think we can move into some of the approaches that we look to, or some of the approaches that we have adopted around norm shifting. So we can move on to the next slide. Okay, lovely. So when we think of norms shifting, it is a very broad concept. It's a very abstract concept, and there are many ways of achieving normative shifts. And we all have achieved, to some extent, normative change in our various practices and in our various professional fields. But we at Busara try to create an objective approach to how we ideate around behavioral challenges. And as Chimelu mentioned at the beginning, and as we'll hear from our other esteemed speakers and from Halima, that one of the main missions of the Nigerian Social Norms Collaborative is to help thinking around objective ways to approach social norm shifting. And we at Busara, we have a standard approach to the way that we address any kind of challenge, any kind of behavioral challenge, and the way that we ideate solutions for our clients. And it's a very simplified approach that involves 5 main steps. It begins with aligning, which is basically understanding what the challenges are from both perspectives, both the supply and demand side. Then it continues on into designing, then we assess and test, and then we share. But broadly speaking, our approach is divided into two parts. We have a qualitative approach, and then we also have a quantitative approach. And we'll go through this approach in a little bit more detail. But just to clarify that this approach is what we apply because we're sector agnostic. We work in many sectors: healthcare, education, agriculture, and finance. But this model is a template that can be applied in any field, and especially within the field of normative shifts or normative change. So the first step that is outlined is align and understand. And what we mean by this is really getting an understanding of what the social norms challenges that we face. The first step is defining the problem statement. So what are the norms that we're trying to shift, and what are the behavioral outcomes we want to see? As I said, social norms is a very broad, abstract concept, and it's an umbrella term that can apply to so many things. It can mean so many things to so many different people. So when we have a social norms shifting agenda or normative shift agenda, we have to really break that down into what is the final behavioral outcome we want to see. So for example, we can have social norms agendas around family planning, but what specifically is the behavior that we want to see? What exactly is the specific problem statement? Is it that we want to improve the dialogue around family planning options with young women before they get married? Or is the outcome that we want to see more new mothers, so more mothers that have just delivered, consider family planning during their postnatal care experience? So those are completely two different things, but they're still under the same umbrella of social norm shifting with respect to FP. But you can see that we've broken it down into specific behavioral outcomes, because when you do that, it's easier for you to create social norms shifting interventions that are very targeted. The second step is, or the second aspect of align and design. So please go back to the previous slide. Okay, so the other element of it is defining your target group, which we all know this. So being very specific about who the target audience is, and then also mapping out the key stakeholders. Who are the external parties that are custodians of social norms, or who are the gatekeepers to the trends and the social norm, the social practices around whatever behaviors that you're trying to improve. So, we list out community leaders, household decision makers as some of the key decision makers. And then finally, once you've defined the problem statement, you know the target group, and you've understood who the decision makers are, you can then begin to study. And it's very important to study because you're providing more context and you're helping to validate the problem statement. Like at the beginning, Chimalu read out the stats around FGM, and it was quite surprising. Most of us would assume that it's more prevalent in the Northeast, but we see that it's actually more in the South. Studies have helped to validate that problem statement. So when you're trying to when you're trying to design an approach to norm shifting, it's very important that you first start off with aligning, making sure that the assumptions that you have around the current social norms and what are driving the current social norms is validated with research, both with the supply and demand side and also with key decision makers. Okay, so we can move on to the next slide. Okay, and the second step, once you've aligned and understood, so you have your problem statement, you've validated with studies, either in-depth interviews, key informant interviews, and demand side engagement, you can then begin to design a strategy around norm shifting. So this is where the ideation around the intervention begins. And we usually start off with co-creation, and it's something that we all do in this space. It's very common practice, but many years ago, in the development space, it was very common to see donors and funders and program managers sitting around a table and creating solutions for people that they had no real depth of connection with. So co-creating just means bringing in the demand side, bringing in the target group as part of the body of individuals that are actually creating the solutions. You get their perspective. And also it's good to validate the interventions you're creating and making sure that they're actually relevant and measurable in terms of norm shifting. And then once you've done that, you want to prioritize. Co-creation is great and you'll get many ideas, but you won't get many feasible ideas. So it's important that you prioritize all the ideas coming out of the co-creation and shortlist what is measurable, what is sustainable, and what is feasible. Because at the end of the day, we want to be able to measure the change in norms. We want to be able to measure the impact of normative change. And because it's such an abstract concept, we need to find ways to do that objectively. And that's what prioritization helps us do. You know, it helps us to identify what is the cost, what are the KPIs that we can meet with these interventions, and then for how long can it run without any kind of monetary support. And then finally, you prototype. Prototyping just means before you scale and test, you just get a small group of end users or a small group of the target group, and you just share the ideas that you've co-created and prioritized just to test if it's still as relevant as you had hoped. And you can do this through focus group discussions, A/B testing, and some very basic observational studies. Okay. And then finally, the last step, or before we go into the last step, one key framework that can help with step 1 and step 2, so helping you in aligning and understanding. And we can think of step 1 as a diagnostic phase, right? So if you think of the social norms intervention as the final prescription that you give, maybe as a doctor, first of all, you have to go through a diagnostic phase where you kind of understand what the problem is. Then you go through a prescriptive phase where you prescribe, and then at the end you evaluate how well your intervention has worked. To help you with the diagnostic phase, we try to apply a framework that is based on the COMP-B model, which is a very common model within the space of behavioral science and psychology, which tries to break down behavior into some of the main 3 driving factors. And the main 3 driving factors of behavior are, number 1, your ability. So does the target group have the ability to adjust their norms? Is it within their capacity? Is it within their scope to change their norms? And also, what are their knowledge gaps? What are the financial constraints to doing this? Then we have opportunity. What are the opportunities we're giving the target audience to change their norms? How are we helping them, making the solutions more accessible? How are we making social norms normative shift more accessible for the target audience that we're dealing with? And then finally, motivation. What is the motivation we're giving? Is it intrinsic? Is it extrinsic? How do we make it more sustainable? So breaking down your study phase and your ideation phase into these 3 buckets can really help you pinpoint, okay, for this particular normative shifting agenda, we need to focus more on opportunity, or we need to focus more on motivation, or we need to focus more on ability, building capacity, knowledge, understanding. So this can help you really synthesize where the problem lies, and then you can direct your efforts to bridging the gap, whether it's opportunity, motivation, or ability. And then finally, step 3 of our approach is testing and sharing. So once we've ideated, once we've prioritized, and once we've been able to validate whether it's a motivational issue, a capability issue, or an opportunity issue, and we have designed the intervention that we want to implement, it's always good to test, run pilots. I know we're very eager to scale, great ideas without testing, but it's very important that you give enough space in your budgets, give enough space in your timelines to pilot whatever social normative shifting interventions that you've prioritized. And it really helps to assess the impact before you scale up. And because social norms shifting is an iterative process, meaning that it's not set in stone, what you tried 3 months ago may not be feasible today. What was successful 5-10 years ago may not be successful today. I know we keep going back to the same tried and tested solutions of, community engagement, traditional leadership engagement. Those may work for some time, but, as, the dynamic and relationship within communities change, it's also important to keep testing new ways of achieving normative change. So that's why we always encourage a testing phase. Just see how your interventions work over a small period of time, and then you can go back, refine, and scale. And at least this helps to adhere to an iterative process. And finally, just to talk through some of the learnings that we've gained There are so many learnings, and I think we'll hear from the other speakers on some of the great work that is being done, both in Nigeria and outside of Nigeria. But just on a very high level, some of the things that we've learned in terms of normative change or social norm shifting is, number one, we always, we know that social norms, we need to leverage on social proof and social norms, but it's important to distinguish between descriptive social norms and injunctive social norms. So there's a difference between telling people what they should do, which is injunctive social norms. So we tell people, use a skilled birth attendant, take your TB medication, go for ANC meetings. We tell people what they should be doing, but it's very important that we show people what is being done. And that is what descriptive social norms is. It's not just about telling people through messaging and advocacy what they should do, but it's showing people, others within their sphere, others others in their sphere of contact, others in their communities, others in their localities that are doing the behavior that we want them to adopt. So showing women, other women in the community that are using ANC, showing women, other women in the community that have used family planning, and as a result, they've been able to spend more time developing their skills, their businesses, and growing their family more productively. So you leveraging injunctive norms in addition with descriptive social norms is very important. And then we've also talked about iteration, how it's important to keep testing new ground or keep pushing the boundaries and not just relying on the tried and tested, community advocacy to drive social norms change, but testing out new ways to achieve the same impact. And then avoiding negative social proof. So it's tempting to kind of focus on the negative, but as we try and build social behavioral change communication, it's always important to focus on positive descriptive social norms or positive social proof. And then finally, we have the ethical considerations of norm shifting, being respectful, being compassionate, and also being attuned to the diversity of the group that you're dealing with. And finally, we have the fundamental attribution error, which just explains that sometimes it's not really down to culture or religion. Sometimes it's just context. One key example could be the low rates of skilled birth delivery in Gombe State, for example. Many people try to attribute it to the culture, to the region, to the religion, but actually it could just be the context. It could just be that there's limited transportation services in the middle of the night, and women that are about to give birth can't get to the PHC, so they have to give birth at home. So trying to make sure that you're not discounting the context of what the target audience is going through or what the target audience has to deal with, and not just judging and basing assumptions on tradition, culture, religion, or ethnicity. So trying to consider the context that is preventing social norms change. So with that, I'll hand over to Chimelu and Halima to go through the next section. Thank you.
Thank you. Thank you so much, Maryam, for taking us through that. Very exciting to hear about all of the key steps and strategies for designing norm-shifting interventions. Of course, ensuring that those interventions are adequately mapped and profiled, and that the solutions actually sort of developed jointly with all of the target groups and stakeholders, so that you have a more feasible and homegrown strategy that's been implemented. So thanks a lot for that, Maryam. And we're just going to be towing that line to begin to look at some of the key case studies that have been implemented or interventions that have been implemented that have applied a lot of these strategies. And we would like to just have a look at an example of that from the Nigeria Learning Collaborative. And Halima will be taking us through the community-led initiatives case study. Over to you, Halima.
Thanks, Chimelu. So yeah, as we mentioned, with the Nigeria Learning Collaborative, a lot of the interventions that we've seen for norm shifting that we wanted to highlight are community-led. This is because we found with community-led groups or community-led norm shifting interventions, because the community resources that you're leveraging are people that influence the wider community. They're people that have that rapport and trust between the particular people that might be practicing the norms or reinforcing the norms and the community groups. So for instance, anything from the community resource groups, which basically would be any association of societies that the members of community would either be part of or they would hold in high regard, to community leaders, and lastly to champions who could be like philanthropists or people that basically over time, for one reason or the other, have built that respect and the community revere them, and so they listen to them. So I'd like to speak a bit further about using community leaders for norm shifting interventions, particularly the traditional leaders. On the next slide. We go through the different interventions that in Nigeria we've sort of used community leaders to drive this, starting from eradication of wild poliovirus in Nigeria. As some of you might be aware, in northern Nigeria, up to the early 2000s, we're still having cases of wild poliovirus being identified within the communities, and that's largely because, you know, as a whole, a lot of the communities were basically rejecting the vaccination. So there was a lot of drive to use traditional leaders whom the communities trust, revere, and have that great influence over the communities to actually be the people to provide the key messaging of polio vaccination. And as you can see in the picture, it's one of the images of how far the community leaders went to. You know, we have some community leaders actually demonstrating physically just taking the vaccine to prove that, you know, the vaccines are safe and, you know, you can easily give it to your children. And that sort of built that reassurance that their community required and sort of took on vaccine in swarms. Based on that experience and what we'd learned from that, we also use that to still tackle routine immunization hesitancy, where you have traditional leaders, again, once more intervening directly with their community, where people are unaware of the benefits of routine immunization, or they have perception of, you know, why this might be not what they're looking for, considering, you know, the kids are healthy and suddenly you want to give them vaccines. So again, we use community leaders in this to just basically directly interface with the caregivers, with the men that the caregivers actually listen to drive routine immunization hesitancy. And once more, we saw tremendous success when we started incorporating traditional leaders. And because of that, we leveraged that success again when the pandemic happened a few years back. In the whole messaging of COVID-19 vaccinations from last year to this year, we again use traditional leaders to actually demonstrate and to drive the whole from IPC guidelines to actually showing that, you know, I have my vaccine, so, you know, encouraging others to go take their vaccine. And once more, again, we saw an increase in people taking these vaccines. So in the next slide, I'd like to go further into how we actually use traditional leaders to tackle routine immunization hesitancies. So as a lot of us might be aware, some of the common social norms that affects under 2 children immunization is basically starting from home deliveries, where especially in northern Nigeria, women that give birth by themselves and give birth at home are considered to be stronger women than those that would have required assistance and gave birth at facilities. So of course, a lot of women, first of all, actually don't want to give birth in the facility and they'd rather give birth at home. And what that means translates to with regards to immunization is a lot of women, a lot of children miss their birth dose, particularly the hepatitis B0 dose, which, you know, as we know, has a very short time span within you can give. And then this is further exacerbated by another social norm in northern Nigeria as well, where for 6 weeks, a mother that's just put to bed is expected to rest and is usually confined at home, not expected to be involved in any chores or anything like that, which is good for the mother. But unfortunately, what then that means is that child, again, has missed the birth dose, but is likely to miss the next set of vaccines up until after they're 6 weeks of age. So again, you have additional defaulters, basically, or rather additional number of kids that start in their immunization at a later stage than we would like in accordance to the API schedule. And then lastly, we also have the concept or the norm where the mothers aren't able to just walk out of their homes by themselves. They need the permission of the husband. So like 6 weeks later, when the woman is back in her house now, And, you know, if you were to intervene and get her to go immunize her child, without the permission of the husband, she's unable to leave right now, to take the child for immunization there. And then even if the immunization team is just sort of right outside. So having this in mind and knowing all these social norms that we sort of explored and identified through various processes was then what we came up with the routine immunization, the name-based strategy solution, where we leverage the traditional leader. So the traditional leader is someone influential. It's someone that has exemptions to some of these norms I mentioned. Like for instance, whereas it's difficult for a male to access these caregivers when a woman doesn't have the permission, of her husband to go out and take the child for immunization, the traditional leader can step in and speak directly to the husband and, you know, ensure that that is sort of redressed going forward. But more importantly is with the name-based strategy, we made the traditional leaders to be the custodian of the community data. So all line listed children, all newborns within the community are sort of registered by the traditional leader. He gets this information from various means, from the parents, from other parties that are involved with, like, you know, for in-home deliveries, for instance, a lot of the time when that happens, it's in the presence of a traditional birth attendant. So the traditional birth attendant can inform the traditional ruler in that setting of a new birth, and he just puts it down with his register. And after a while, periodically, the traditional leader then interfaces with the health facility and gets the immunization status or updates of all the children that he has line listed. And with that, he then identifies the children or the households or families that basically haven't taken their children for immunization for one reason or the other. And the traditional leader is then able to interface and go directly speak with either the husband or whomever it is that, you know, might be the necessary bottleneck that he needs to readdress. In some cases, he gives permission, or sometimes, you know, we've seen cases where the families are happy to give the child, because the mother can't step out for the 6 weeks, but they're happy to give the child with the traditional leader to go and have the child immunized. Maybe sometimes they're happy to have the child in accompany with someone, another minor, maybe an older sibling of said child with the traditional leader. And so basically that's in how we've used the traditional leaders, or like traditional leaders that have supported routine immunization uptake in Nigeria. So on the next slide, this just presents a schema summarizing all this. So, I mean, as you can see on the left-hand side, we have all the different parties that feed information to the traditional leader. And he then uses that information to do the necessary step, whether it's line listing the newborn or whether it's identifying a defaulter based on the information that he's received from the health workers. And then, you know, that one-on-one advocacy that we mentioned, that he's able to intervene and address when we're talking about routine immunization. But so also the same approach is similar when we have an under 5 children. So during the polio campaigns, for instance, we found that communities where inaccessible for one reason or the other, we would always use the traditional leaders as the gateway or gatekeepers into such communities. They would be the ones to identify people within their communities that can then, you know, work together with the vaccination teams to encourage, to allow for the wider community to allow the vaccination team move around and immunize their children. And so also the same approach with regards to the COVID-19, where we have the community leaders being the gateway, again, speaking with adults, interfacing them and helping with rumor mongering. And as we can see on the right-hand side, some of the successes that we've been able to see, starting with routine immunization, which I mentioned, polio, which I mentioned in the early 2000s, we still had wild polio viruses, but then, you know, by the end of 2019, we were actually certified free. And likewise, in routine immunization, we can see the case study of Yobe, where at the 2011, this was before the name-based strategy that I had mentioned earlier was rolled out. We had about 13% penta coverage in the state. With time, obviously, that percentage actually reduced, but with the introduction of the name-based strategy from late 2016 to early 2017, we saw like a great increase that, you know, the support of traditional leaders and inclusion of traditional leaders has actually provided for the uptake of Penta-3 in Yobe. Vaccination, just see that, you know, with increasing numbers of, you know, citing traditional leaders as one of their supporting figures. So all in all, able to leverage and use their influence to encourage of a wider community and sort of help in that shift in that norm that might have been hindering whatever health intervention or health program we've been able to roll out. Over to you, Chumilo. Thank you.
Okay, thank you very much, Halima, and thanks a lot for that great presentation. Just amazing to hear about community-led interventions and how effective they can be, and all the results that we're seeing in northern Nigeria and even across the whole country altogether, just seeing how COVID-19 vaccination rates have grown for the last couple of months. It's great to hear that Nigeria is amongst one of the countries that is doing well with that, and the community leaders and traditional leaders have been instrumental in pushing that. Just before we get into the next part of the conversation where we discuss the other case study from East Africa, we would like just to play a very short snippet. So just to take a short break and play a short snippet from our podcast that we released this October. Also great to see all of the questions that have been coming in, and we'll be addressing those once we get back. So please stick with us, put your questions in the question and answer section or in the chat box, and we'll be right with you. Thanks, everyone. Okay. All right. Hi, everyone. Apologies for that. Please confirm that you can hear the podcast, the snippet. If you can, please just kindly signify in the chat section. Okay. Okay, great. Apologies for that, everyone. I think we'll get back to playing this a little bit later. And thank you very much for all of the questions that are coming in. Very, very exciting to see how we're all engaging with the content. And we're going to start to hear those or listen to those in our in the question and answer section of the conversation, but would like to just quickly go ahead and take the case study from the East Africa LC. So we've already seen community-led interventions and how exciting the results of that can be. But we're also just going to look at what the role that social media plays and how effective it can be in norm shifting. And I'd like to hand over to Madanda from Care International in Uganda, and one of the key members of the East Africa Learning Collaborative, to just quickly take us through this in the next couple of minutes, and then we can, kickstart all of the exciting conversations that we've already started to mention in the chat box. So over to you, Madanda.
Thank you very much, and greetings from Eastern Africa. I guess most of you are the West, we are in the eastern part, the opposite side of Africa. Very exciting to be here this afternoon. We are slightly a few hours, I think, ahead of Nigeria. So Eastern Africa Collaborative is mainly a network of researchers, implementers, evaluators, and policy advocates on social and gender norms. We like to add that one for emphasis. And we've been together for a number of years, I think more than 2 years now. And, you know, generally sharing information on how gender and social norms can be shifted. And I think if you go to the next slide, it shows the countries that are participating in the Eastern Africa Collaborative, where I am working as a principal researcher. So the countries participating are Uganda, Kenya, Tanzania, as you can see on the map, Rwanda, Burundi, Ethiopia, South Sudan, and the Democratic Republic of the Congo. These fall mainly in the Eastern Africa regional bloc, and both Francophone and Anglophone speaking countries. This afternoon, I'm going to showcase just an example of one example of using social media to expand and deepen discussions and reflections on gender and social norms. And this example I'm going to use is what we did on the launch of the second phase of the Eastern Africa Learning Collaborative on the 27th of April, 2022, whereby we launched virtually using Zoom, a Zoom link, to reach out to various people across these different countries. So you can advance. So to be able to multiply conversations, please move to the next slide. We chose to work with influencers, 10 influencers who are located in different areas, but that were working with us to generate discussion and trigger discussion around the theme of collaborating to deepen gender and social norms practice. And so we created a hashtag, which we deployed on Twitter, that is Let's Talk Social and Gender Norms. And the different individuals were discussing around this hashtag. Let's move for you to see some examples of the different people. So we had, for instance, on the right here, you can see Daphne. For instance, on the left, you have Natabalo. And, you know, all these different young people and the influencers were picking on different topics and engaging with their followers, but also different populations. If you move to the next slide, you also see other examples of, again, you know, people engaging on different topics, discussing issues of masculinity, child marriage, and so on. Move again. Move the slide again, please. Yeah, so when you just pause here a bit. So when you look at this slide, it's where we see the message, the main message that I'm communicating this afternoon. People who signed into our Zoom link, they were less than 100, for example, just like the number we have here. But on this hashtag, those individuals and those who participated through the Twitter handle were able to make 1,000 posts, which were done by about 212, which means some of those were not necessarily in the room. And this generated 2,464 engagements. And those are like likes, retweets, dislikes, and so on, comments. So there were 2,464. Now we deployed some software which was able to also track how far the message had gone. And so the reach here measures the message, how far it had reached directly. So it had reached 3,600,000 individuals. And then that message was retweeted, and so they were in direct views and so on, and created 22 million impressions, which means that the 3.6 million people had seen this message about 6 to 7 times, and therefore promoting recall and engagement, etc. So from this example, we see that social media, in this case, Twitter, was very useful in multiplying our reach around this topic on social and gender norms. So let's move to the next slide, please. We also tried to say, okay, what are the geographies? I'm sorry, you may not see very well here, but when you look at the blues, that's a global map. You'll see that we had a high concentration of discussion in Uganda, but also in other parts of Africa, South Africa, West Africa, but also Europe, North America, South America, Brazil, and many other parts. So the kind of reach that would have not attained if we hadn't gone virtual. Move again. We also looked at, these are the basic topics that were being discussed. Some of them, marriage, social norms, gender, and so on. Let's move to the next slide. So when you look at the next one, which is very nice for us who are also interested in gender norms, you see that the people who interacted with our content were 61% male, at least those who identified as male, and 39% female, which probably shows that if you're going to use digital technology or social media, be mindful of the gender digital divide, because you may probably reach less female. So there's need for some kind of innovation there. Let's move again. And okay, this was basically capturing those who reacted positively or negatively to the content or were neutral. And again, the results can be seen there. Let's move again. Now, this is also critical. You could see here that 87% of the participants in our content were those who retweeted. They were not the original people in terms of the message. So you could see very, very useful there. Move forward. The last slide, I think. So this is also very important. Who the people that interacted with this content, what kind of devices and applications are they using? And the majority of them were using mobile phones, which were smartphones, Android and iPhones, and only 9% used desktop or web technology. Again, showing the importance of mobile technology. But of course, maybe this also the underlying issue is around affordability. So in summary, the message I'm trying to show here is that social media or digital technology has a good potential to help us expand the reach of our conversations across the world. Thank you so much for your kind attention.
Thank you so much, Madanda, for that. Very exciting to hear about. We always hear about the power of social media and all the different platforms, Twitter, etc. And it's very exciting to see how those can be adequately harnessed to address something as complex as social norms. And really, there's a lot to discuss and listen to and interrogate today. And so we'd just like to get into those conversations. Thanks to everyone who's put in, very interesting comments in the chat section. Thanks, Halima, Madanda, and Maryam for sharing all of your insights with us. I think we'd just like to kick off the question session with just, asking, and this is for Halima, to kind of understand. It's interesting to see all of the progress that we've seen with community engagement, as we call it, in Northern Nigeria. But of course, the context of that is, very defined sort of like community structures, and there's that existing influence, that the community leaders have over, the different communities. We don't have that kind of structured system in the South, and we've just seen Southeastern Nigeria, very surprisingly, is where we have that very high FGM rate. So I think my question is really is this something that would work in, the more southern hemisphere of the country? And I mean, how can it be deployed? What can we expect, or how can implementers kind of think about that, implementers in that region? And, we're talking about COVID-19 vaccination. We've done well, there's a long way to go. So, just putting that in perspective as well, could you maybe share some insights around that?
Thanks very much, Jamilu. Yeah, you're absolutely right. So as you mentioned, in the northern Nigeria, the traditional ruling system is a bit more homogeneous than with the southern structure. So yes, for COVID-19 especially, you did leverage on traditional leaders to sort of help in advocating and promoting uptake of COVID-19 in the southern states, but the approach was slightly different. Unlike in the northern approach, where we usually started from the higher level emirs down, and like the sort of a direct way of communication flow from the emir down to the grassroots, or community level traditional leader. With the southern approach, it was required more interventions or like interaction with all the traditional leaders directly, because like you've sort of pointed out, it's a bit complex. There are different groups of traditional leaders. There are different types of traditional ruling system. So like you can't just speak to one emir or chief and expect that information will be cascaded down to everybody. At best, that chief can speak to his or her own direct community. So we had that, and the effect was a bit minimal because of the circle of influence of these chiefs was a bit smaller than you would sort of anticipate or like you would expect. So because of that, the traditional leaders were not the only leaders that we sort of had to engage in the southern system. Even though in the north we did the same thing, but the heavy influence was more on the traditional leaders. In the south, the community leaders in general, because you might find someone is a leader that has a greater sphere of influence than the actual community leader in that particular community. So that, we still went with the community leader approach, but it was a bit more multi-pronged than in the northern region. Over.
All right, thank you so much for that, Halima. I think that's very interesting, and I think we'll just move to Madanda, but only shortly because we have a lot of questions for you in the chat box, which we'll subsequently take. So thank you very much for the presentation, and so exciting to hear about social media. And I think until now, a lot of us, myself included, we're not exactly, very certain or very clear on what the power of social media and how it can be effective, even in norm shifting. So I think, like many other people on this call, I would really like to know, how did you come up with this strategy? What informed it in particular? And what were the early indications that it was going to be successful, in having the reach that you did have?
Yeah, thank you very much. 2 or 3 main reasons why we took to the virtual space. First of all, the start of our collaborative was also coincided with the outbreak of COVID-19. So that made it difficult to even think of physical meeting. The resources available were very limited. The first phase, almost 2 years, was only $70,000 US. The geography that we're addressing, by then we are looking at 7 Eastern Africa countries. We are now 8. So we had to think of how we can leverage technology, digital technology, to have to go across those geographical boundaries. But again, when we look at the population, more than half actually of the Eastern Africa population is youth, is very young actually, more than half are below 18 years. And so you'll find so many young people, communicating through the use of social media and new technologies.
Okay, thank you. Thank you very much for that, Madanda. It's great to see how we can, sort of adequately harness what has become prevalent in society, the advent of social media and all the different platforms. And I think we'll also come back to you to get some additional, thoughts and feedback. We do have some questions in the chat box. But Maryam, I think this is specific for you. And another Maryam as well is asking, how can a program effectively cost for social behavior change interventions when it's time bound? Of course, we understand that it does take a bit of time for people to make changes on a particular behavior. And so you did also mention that it's something, that will require several iterations and, of course, a bit of time for adaptations to happen effectively. So the question here is really, should programs plan to cost for SPC separately? I mean, are there also other considerations, apart from the cost in that regard?
Yeah, that is a great question, and it speaks to the practicality of implementing social norms interventions. And I think, yes, I think it's important that you need to cost for social behavioral change communication or interventions in your program budgets. Especially, I think the most important thing is to set precedents. So I know it's time bound. So you can budget for a implementation and testing phase just to set the precedents that this works. And then you can use that to leverage for more funding and time to implement widely or to scale up. It is quite difficult because most projects, they want to see the impact now. And, social change, it takes time. And we need to respect that and give enough time for whatever interventions we're implementing to have the impact we want to see. But I think we should add a buffer to our budgeting and timelines just to allow us to test and set precedents and then use that to leverage more work. I think that's one of the things that we do at Busara. So when we're time bound, we tell clients that, look, the kind of change that you want to see, we can't make it happen in 3 months. We can't transform an entire community approach to, new and modern ways of healthcare delivery within like 6 months, but we can show precedent. So we can say, this is what we feel can change social norms in the long term. Let us demonstrate how it works in the short term with maybe, we do a lot of behavioral lab studies. Lab studies meaning that we don't necessarily implement full scale in the field, but we'll just do, I would say, a proxy of the intervention in a lab setting and see how people engage with the solution. And then we can use that to set precedents and say, okay, we tried this new digital way of delivering health education to women. We brought women into the lab, they engaged with it effectively. There was good understanding, uptake was good. We were able to, achieve a certain level of capacity amongst the women when we did this. We believe that if we scale it over a period of time, we can achieve more wide scale impact. So that's what we do. We try to build precedents with small projects and then use that to leverage for more time and more funding to scale up.
Well, thank you very much, Maryam. And I think that sounds very interesting. As of course we understand, or we're just hearing from you now how vital it is to sort of take things in sort of bite-sized pieces rather than an entire chunk in such a way that we're able to generate, that required evidence over time that then allows for full-scale implementation. So that's really exciting to hear. We're going to go back to Halima for a bit here because we have, some other questions in the chat box that are speaking to. We've seen the name-based strategy. We've seen all of the great things that have happened. But can you, I'm sorry, rather, this is Godfrey's question around how the community sustains the actions, of the intervention post-implementation. And I mean, that's something that's very vital to speak to. Sustainability is the watchword, so if you could just, speak to that as well. We also have a second question for you here around the name-based strategy. All great, but of course we know that there were some bumps along the way. So could you shed some light on the challenges you encountered in implementing this strategy, or we encountered, and then how those were adequately navigated?
All right. Thanks, Jamilu. Thanks, Yetunde and Godfrey, for your questions. So with regards to sustainability, I think that's the beauty of having a community-led intervention. Because the intervention by design is integrated within the community, it becomes less dependent on you, the NGO or external factor that's actually sort of initiating this finance. So beyond just those initial costs where you might, have to advocate to do some trainings and some, initial like house remunerations and things like that. It's very easy to wean off your support as an external party and just let the community actually run through its course, which is sort of what we have with the name-based strategy. The initial rollout of the strategy required a lot of our support and a lot of our guidance. But, as this year in, year out, we sort of tempered our support and just let the community structure that we sort of put in place just run through this directly. So now, I mean, Yobi that I gave this an example for where we rolled out the strategy some years back, by and large, the community-led the name-based strategy intervention specifically is done and, sort of supported by the community with support of the government, because it's been institutionalized within structures that are domiciled with the community and the government. By that, I mean traditional leaders and the health workers and, the LGA's team that are the supervisors to this whole entire interaction. With regards to challenges, yes, I mean, there were quite a few challenges. One of those is, I mentioned one of the key roles that we have was to have the community data, community indices domiciled with the traditional leader and get them to be the champion. And when we rolled out the strategy, the initial thought was a lot of the traditional leaders would be able to line list. But one of the challenges that we've found when we're implementing this is, the traditional leaders are not able to actually write down the names of this children in English. And so, depending on what community it was, we then have like a different supporting approach where the community, the community leader at the grassroots level I'm referring to, that does the actual line listed, is then supported by either the ward community engagement focal person to actually just, update. So the traditional leader just keeps a record, more often than not by heart, and then just says the name, and the ward technical person actually writes it down. Or in some cases, the traditional leaders actually have kids, their own children that are literate, and so they just do the identify and take note of the names, and then they get their kids to write down the names for them. And so that the reconciliation, data reconciliation that happens with the health workers sort of goes on through. Over.
Okay, thanks a lot, Halima, for your comments, for your responses. And I think this ties very nicely with what Maryam had discussed earlier with Busara's strategy or considerations for norm-shifting interventions. And of course, the watchword there is if you involve all of the key players in the community, then you're going to have something that's very sustainable. Essentially, if you plant a tree, well enough, it should grow on its own. And of course, just ensuring that there's that iterative process. We're going to have issues along the way, but just ensuring that we're going back and doing more of sort of like a responsive feedback type of mechanism. And that's really great to hear. We'll just sort of move a little bit, and we want to sort of probe a bit, Madanda. We can see, some questions here around whether the engagement translated to some successes. And then, of course, we understand that the goal of that was more to sort of get the engagement and multiply the reach. But I think our major question to you would be what's the second phase for this, right? We've done this, and when we've gotten this kind of reach, what's the next phase, or what do you hope to achieve as you move on? So please, let's keep the questions rolling in the chat sections. You can also raise your hand, and then we'll take that. And then Kadia, we're going to take your question very shortly. So please, over to you, Madanda.
Yeah, thank you very much. As you'll notice, the main focus of the Eastern Africa Learning Collaborative is to create a network that has as much reach as possible and reaches out to as many people as possible to be able to share and learn and implement. And then the individual members do several projects. So this early experiment has shown us that it has a high potential to reach out, but of course with the limitations as you saw. in terms of affordability, in terms of the gender digital divide and so on. So we have to be mindful of those and maybe supplement those with other approaches, for instance, the community outreach methods that are being used, like, for instance, in Nigeria. So the potential reach is there, but with limitations and caution.
Okay, thank you very much for that explanation or that response, Madanda. We would just like to take Kadiat's question. I can see your hand is raised. Please feel free to go ahead and respond or and share your question. Hi, Kadiat, you're on mute if you're speaking. Hi, can you hear us? Okay, looks like you might be having a bit of a challenge. Musa, our founder, you can go ahead and ask your question. Hi, Mohammed, you are on mute if you're speaking. We can't hear you from our end here. All right, while we wait for them to unmute and speak, we're just going to take another set of questions for Maryam from Yetunde, just speaking about how you were able to navigate the influence of negative social proof on your target beneficiaries, and just citing family planning as an example. And how that ties with hesitancy with service uptake. So Maryam, please, you can go ahead and take that question.
Okay, thank you. With negative social proof, it's really around, so for example, around self-injectables. Self-injectables is a fairly new form of contraceptive, although it's not new, but in terms of its introduction into mainstream uptake in Nigeria, it seems to be fairly new. And maybe there isn't as many women using self-injectables as maybe the pill, for example. So with negative social proof, it's just around trying not to stress that, because people conform. So for example, if you tell women, this is a new form of this is a new innovative form of contraception, it gives the sense that it's not tried and tested. So rather than reinforcing the low numbers of uptake, you really want to reinforce the positive around that particular form of contraception. I'm just using this as an example. So the way that we adapt this in our messaging is that we're always trying to reinforce the numbers, reinforce the number of people that have already used the product, the number of people that have benefited from that form of contraception. So that's the way that we try and play on positive versus negative social proof. And it's just in the way that you frame. It's really about framing, how you frame communication, how you frame the advocacy, and how you frame the dialogue that you're having with women. So just making sure that you're highlighting the community of women that have already used that product, and then the benefits that they have experienced or how it has benefited or impacted them, rather than highlighting the fact that, it's new or it's innovative and things like that, because people tend to shy away from things that are new versus things that are, well adapted. So that's just a simple example. But I'm not sure if that answered the question. Was it about a specific example, or just how we played on negative social proof in general?
Yes. Hi, Yetunde, you can go ahead and speak to clarify your question.
Okay.
Yeah, so maybe we just hold on a bit for her to, respond to that.
Okay, lovely.
Hi, Yetunde, please go ahead. I think you're on mute if you're speaking. Okay. All right, Yetunde Mohammed and Kadieta, we've given you the mic, so please go ahead and speak if you have any comments or any thoughts. Would really like to hear from you. All right, while we wait for them to respond, I think we have another question in the chat box for Halima, and really important to say that a lot of the questions that you've put in the chat box, we've attempted to answer those. Okay, I can see the question's been answered, but maybe Halima, you could just highlight this for everyone else, some of the lessons that we're learning from the Yobe experience and what other states, can do to replicate this effectively.
Thanks, Jamila, for that. Yes. So, I'll speak to quite a few of the lessons learned, I think, since we rolled out this exercise, starting from the initial stage where we've done this. Actually, before I mention, I think it was Godfrey that asked for additional information about the strategy. So perhaps we'll put the link to more about the CE strategy in the chat box for everyone to access. But yes, back to the question at hand, Chimilu. Yeah, so one of the interesting lessons learned that we've had is with the Northern Nigeria, there's sort of like a clear hierarchical approach to the traditional ruling system. And although the name-based strategy is sort of hinged upon the community leader at the grassroots level, the Meangwa, which is basically the ward level traditional leader, we found that before rolling out the strategy, there is need to actually do that targeted advocacy to the higher level traditional leaders. This is because once the strategy comes into place, because of the sustainability issue, like the traditional leaders actually do this line listing and defaulter tracking out of pocket. Like we're not providing them with any stipends or anything like that for this. But so as you can imagine, with time, it becomes like a tedious exercise, and some of them might not be too keen to do this effectively. So having that constant communication line with higher traditional leaders that they report to, and keeping them abreast with like performance of the traditional leaders below them and the status with regards to immunization as a whole, means that oversight is beyond just us and the government, but even the institution that these grassroots traditional leaders report to is interested in this performance, and that there's that community ownership and accountability to then drive the sub-state community leaders to actually, do their role and sort of challenge them when they're not participating or when there's like a gap and identified. It's quite, not only that, I think in some of the instances we've had the district heads who are basically often usually at the state level actually take ownership and do their own special drive, like, things like Operation Show Me Your Card, where they just go down their community and actually just ask their community dwellers to see, and everyone wants their district head to be happy and pleased with them. So it's sort of, again, further improves and promotes that community ownership and accountability. So yes, rolling this out in any other state, it's definitely not just going directly to the people that you'll be working with, but making sure that all lines of communication and reporting lines are sort of well aware and abreast. Thank you.
Okay, thank you very much for that, Halima. Thanks for elaborating on the lessons we're learning with the name-based strategy and what we're doing differently. It's been really great interacting with everyone here today, and sort of getting a lot of the insights. And I think for us specifically as well, we would just really like to know, if you've kind of implemented any of these interventions or any of these strategies in your own body of work, or in any interventions that you've worked on, and would like you to tell us about it. So please in the chat box, or indicate by raising your hand. We would like to hear from you what your own experiences are. I think we can take a few of those in the last couple of minutes we have, and that kind of helps us to have a very holistic sense of what an experience in norm shifting is. So please just indicate. You can put it in the chat box, or you can raise your hand and just share with us your own experience with norm shifting. Oh, Beatrice, hi. We will unmute you immediately so that you can go ahead and talk. Please, you can speak. Go ahead, please, Beatrice.
Yes, thank you very much. This has been an interesting webinar. We've learned a lot. And Halima just hit the nail on the head when she talked about the activities at the community level. That is the buy-in of the traditional leaders from the whether from ward or village level and so on. We have had similar experiences, but this happened while the program or the project lifespan was on. As soon as the lifespan ended and we went back, nothing that was, set up during the 5-year period was happening. So how do we engage these people after the life of that project when we move away from this community, specific community? That is the issue, sustainability. I think we should think about it and then see how these other people have managed it so that we don't go into the kind of experience that we had. This experience I'm talking about happened when we tried to do elimination of female genital mutilation in the early 80s and 90s in the Federal Ministry of Health. And also when we tried to promote infant and young child feeding at the community level. Once the project lifespan ended, we went back to the communities where we had set up community support groups through the community leaders and their spouses, their wives. We didn't see too much happening. I don't know whether the situation has changed now that I've retired, but I just thought I should share this experience so that we think about it while we are planning our programs or projects in future. Thank you. Over.
Thank you very much, Beatrice, for highlighting that sustainability is the watchword and many times the greatest concern. So these are some of the things that we are also thinking about, both in our experiences and with everyone they're interacting with. Omaumi, please, you can go ahead and share your own experience or your thoughts. You just need to unmute yourself.
Okay, can you hear me?
Yeah, sure. Please go ahead.
Oh, okay. All right. Cool. So yeah, thank you for organizing this, and I hope that there would be more of this kinds of conversations ongoing. There's a lot I can share, but I'll just pick like one example in Enugu. So I was on a project funded by DFID called the Voices for Change project. And of course, we had to, we were working towards shifting norms on gender equality. And so one of the areas that we picked was women's leadership. So we picked some post-secondary institutions in Enugu, and we had to, of course, do mapping to understand what the norms were around leadership and how those norms translated into behaviors. We were able to shift a particular norm around female leadership of student union government. And this we did through having safe spaces where we had female and male students come in to learn about and also share about gender equality, decision making, and gender-based violence. And we also had a lifestyle brand. I think the lifestyle brand perhaps even worked more than the safe spaces. So that lifestyle branding, which cost a lot of money, it's communications, you have stars behind it, and everyone in school wanted to be cool, like be called the purple person. And so this shifted the norm because there was this school that had never had a female SUG president, even though it's a college of education, even though 90% of the students are female and just about 10 or probably even 95 and just about 5 or 10% are male. And after the intervention, we got a female student elected as an SUG president. Also in UNN, for the first time, a female student emerged as the SUG president. I don't know if that has still continued, women within the leadership of the SUG, but we do know that what has continued has been the healthy relationships that students went on to have, in relation to gender-based violence. So, that was sort of like a pilot for us, really, because there was no way, with social norm change, it's expensive and extensive, and we could not extend that to the whole of Enugu State because we were also in other states. And as the last speaker said, ensuring that the norm continues to stay to replace the old norm then becomes the challenge, especially when these initiatives are driven by donor funding. Yeah, and I think I'll just lastly like to add that from the work we did over the course of 5 to 6 years, it appears that working with young people, may give you more results than working, how they say the fish is bent already, than working with those that are perhaps set in their ways, because norm takes generations to build, and of course it will take another generation then to dismantle. Thank you.
Thank you so much for that, Bumi. Very interesting and exciting to see. And when we have these conversations, we are predominantly or very focused on health, among other things. And it's exciting to see how applicable norm shifting can also be in education or even broadly leadership. And that's essentially what translates to even what the political space or the political landscape begins to look like. It's been extremely exciting to have all of you here today discussing with us, sharing your insights, asking questions. Unfortunately, we're out of time, so we're unable to take any more of the questions or comments. But you can please go ahead and put your thoughts in the chat box, and you can always discuss with us subsequently after this conversation. So we've seen a lot here in our conversations. We've looked at the considerations for norm shifting and how we can adequately map and design interventions that can be effective. And then we even went ahead to look at all the different kinds of unique interventions that have been implemented, from community-based to media, and the impact and the possibilities looking forward to the future. And all of this is pretty exciting. And as the conversations go on, it becomes very clear that there are a lot of things that we need to keep in mind: sustainability, iteration over and over again, and that key involvement of key stakeholders at the community level or at within the target audience. And these are all very key. And we hope to continue to bring you a lot of these very exciting conversations, both in our webinar and in other ways as well. We've shared our podcast with you. We hope that you can go through that and, have a better sense of, or have additional information. And we will be seeing you again in another edition of the webinar, where we sort of focus a bit more on one of these prongs. And it's been very exciting talking to you today. We're going to have to leave you for the afternoon, but in the meantime, you can of course interact with us. We have a lot of our materials and products that are available on the Align website. You'd see the link on the slide. You can also access a lot of the information from the East Africa LC. We would also be sharing some materials after this conversation from Busara, as well as the Nigeria LC, that you can also interact with, that will be helpful in your line of work. Please feel free to just contact us or discuss with us or engage with us. We're available on social media, on Twitter, on LinkedIn. You can also just go ahead and send us an email. We would be looking forward to hearing from you and interacting with you. Until the next webinar series, it's over from us here at SCIDaR and myself. Thank you very much, everyone, for joining. Please have a good afternoon ahead.
Thank you.
Bye, everyone. Thank you. I do want to play the video. I do want to play the video. Play the video. Take one, take one, take one.